So now let's talk about the next point. HIT is heparin-induced thrombocytopenia, the treatment of which is direct thrombin inhibitors like argatroban. So argatroban. So argatroban actually is an anticoagulating agent, which has more bigger anticoagulant effects than heparins and heridins, and both high molecular weight heparins and low molecular weight heparins should be avoided. So if there is heparin-induced thrombocytopenia, then heparin should not be given. So that's why argatroban is given. So next question, F6imab is actually, it's not an factor 11 inhibitor, but actually GP2B3A inhibitor, which binds with fibrinogen, and those binds to other platelets via fibrinogen, and so it is defective or deficient in Langerhans thrombocythemia. So fine. Next question. Next point is hereditary breast cancer is most commonly associated with mutation in BRCA1 and BRCA2. So BRCA1 and BRCA2 are most commonly associated with breast cancer, and these tumor suppressor genes are involved in DNA repair. So how does BRCA1 and BRCA2 mutation cause breast cancer? Is BRCA1 and BRCA2 genes affect the tumor suppressor gene that does not allow the tumor, the cut DNA fragments to rejoin, and hence impairs DNA repair, and the mutation increases the risk of developing breast and ovarian cancers. Okay, next point. Metalloproteinases are zinc-containing enzymes that degrade the extracellular matrix. So metalloproteinases. So metallo means metal containing, proteinase means protein degrading enzymes. So metalloproteinases are metals. Which metal? It's actually a metal containing zinc. So zinc containing enzymes that degrade the extracellular matrix. Extracellular matrix can be degraded by metalloproteinases, so MMPs. They participate in normal tissue remodeling and in tumor invasions through basement membrane and connective tissue. So they help in tissue remodeling. So for example, there's a cut, or there's a big thrombus which has been degraded by giving any antithrombic agent. The tissue now remodels to its original form by using something called metalloproteinases, which are zinc-containing enzymes that cut the extracellular matrix, and they participate in normal tissue remodeling and tumor invasions. So metalloproteinases are the ways through which the tumor invades through the basement membrane and connective tissue, and it metastasizes, or tumor can metastasize to distant organs and move into the blood by degrading basement membrane and connective tissue by the use of metalloproteinases. Next point is about analgesic nephropathy. So analgesic nephropathy is a form of CKD, chronic kidney disease, caused by prolonged heavy intake of NSAIDs. NSAIDs most commonly associated with acetaminophen or paracetamol or Tylenol. The pathological characteristics include CIN and RPN. So analgesic nephropathy. So any analgesic like paracetamol can cause CIN and RPN. So the point actually is very not so easy to understand. So please, I'll ask ChatGPT. Please make it understandable. Okay, next point it shows is, sorry, it is another question and it's not what I wanted to search. Anyways, let me just remove the highlight. So okay, I think it will work now. So here you go. Okay. So analgesic nephropathy is a type of CKD that results from the long-term heavy use of NSAIDs like paracetamol. It causes chronic interstitial nephritis. So it includes two pathological characteristics. So when there is kidney damage through paracetamol, there is the interstitium of the kidney nephrons is damaged chronically. So there is chronic interstitial nephritis, and there is renal papillary necrosis. So renal papillary necrosis. So renal papillary necrosis is the death of cells in the renal papilla, which are the tips of kidneys, medullary pyramids. So there are pyramids in the medulla. So the tip of the pyramids are can be necrosed. So there are two different phenomena, which are chronic interstitial nephritis and renal papillary necrosis. Okay. Next question, the next point we have is protamine sulfate, which binds to heparin. It is an antidote for heparin toxicity, cause chemical inactivation. So heparin can be inactivated chemically by protamine sulfate. Vitamin K and fresh frozen plasma can be used to reverse warfarin effect. So warfarin uh, alters vitamin K's pathways or cells metabolism, and fresh frozen plasmas or vitamin K, when given externally, can be used to reverse the effects of warfarin. So warfarin inhibits protein C and S. So how does warfarin work? Heparin works by heparin works by binding to endothermin 3, but warfarin inhibits protein C and S, which are natural anticoagulating agents in the blood. So because protein C, which are with natural anticoagulants in the blood, which lead to skin necrosis, particularly in patients with protein C and S deficiency. So warfarin inhibits protein C and S, which can lead to skin necrosis. So warfarin, so skin necrosis. What prevents skin necrosis, particularly in patients with protein C and S deficiency, is warfarin. Protein C and yes, sorry. Let me reiterate it. Warfarin inhibits protein C and S, which can lead to skin necrosis. Okay, warfarin thins down the blood. So how does it thins down the blood? Is so protein C and S. So protein C and S are actually anticoagulating agents, natural anticoagulating agents present in blood. So they does not allow uh, blood to coagulate. So protein C and S are actually blood thinners itself. But in protein CNS deficiency, there is high coagulation in the blood. So, to replenish the amount of protein CN, yes, warfarin can be given. This complex is usually seen in the first few days of warfarin treatment. So warfarin therapy. So in while treating a patient with warfarin, so warfarin actually, so there is a paradoxical effect of warfarin uh, in the very beginning of its therapeutic treatment. So it is bridged with heparin. So why is warfarin not given just alone? Is because it inhibits protein C and S, which uh, so it inhibits protein C and S, which paradoxically increases the coagulative property of the blood, and hence can lead to skin necrosis. Therefore, this complication, to prevent this complication, that is skin necrosis, which occurs by the excessive, thrombosis of the blood, we give heparin bridge to prevent this paradoxical effect of warfarin for the first few days of treatment. Next point. Okay. Rifampin, phenobarbital, and phenytoin are potent enhancers of cytochrome P450 pathway. So RPP. Our CYP450 is a very effective, inducing biometabolism enzymes in the liver. So rifampin, phenobarbital, and phenytoin are potent enhancers. So cytochrome P450 can be enhanced by the use of rifampin, so it's an ATT, anti-tubercular drug, phenobarbital and phenytoin, both of them are anti-seizure medications. Concurrent use of warfarin with these result in decreased efficacy of warfarin. In contrast, so if we use warfarin together with these drugs, so warfarin is metabolized more, therefore reducing its efficiency or efficacy. In contrast, cimetidine, amiodarone, so those drugs containing I in the very early letters. So cimetidine, amiodarone, and trimethoprim sulfamethoxazole, TMPSMX, inhibit warfarin metabolism, thus increasing the concentration of warfarin and hence the risk of bleeding. Okay, enterohemorrhagic E. coli, EHEC. So EHEC is primarily contacted after eating undercooked ground beef. So undercooked, so undercooked beef. So beef is one of the potent source of infection uh, of enterohemorrhagic E. coli. Escherichia coli. So EHEC. So there is some hemorrhage produced in the intestine resulting in dysentery. So EHEC. So how is the hemorrhage produced? Is dysentery is one of the primary cause of dysentery is Shigella. So Shigella has Shiga toxin, and EHEC, similar to Shigella, has produces Shiga toxin, which causes hemorrhagic colitis and can lead to hemolytic uremic syndrome. So there are two types, type A and type B. So there's a typical type and type 2, which is a typical type of HUS, hemolytic uremic syndrome. So there is hemolysis, so there is some sort of uremia, and it's a complex of syndromes, complex of symptoms, collectively known as a syndrome. So HUS is characterized by acute renal failure, thrombocytopenia, and microangiopathic hemolytic anemia. So because of uremia, there is some mechanical, or let's say rupture of IBC by any uremia, thus causing hemolytic anemia. So there is microangiopathic hemolytic anemia in uremic syndrome. So there is hemolysis. Those little fragments of RBCs block the block and or interfere the kidneys or normal mechanism or function, therefore leading to acute renal failure, and ultimately much of the broken RBCs are metabolized by the spleen, or broken by the spleen, but and yeah, thrombocytopenia is one of the another features of HUS. Okay, and children less than 10 years of age are at greater risk. So hence, yeah, it makes sense. So EHEC. So whenever there is a term EHEC, you need to understand that there is a Shigella toxin which is producing hemorrhagic colitis, and leading to HUS, so hemolytic uremic syndrome. So because of hemolysis, the kidneys are being blocked, or its functions being affected, leading to acute renal failure, thrombocytopenia, and this microangiopathic. So in the small vessels, the uremic features, the urea, the excessive amount of uremic content in the blood leads to rupture and hemolysis. So children aged less than 10 are at greater risk. XLA. So XLA or Bruton. Okay, so this is the next point. So XLA-Bruton is actually gamma globulinemia. So X-linked gamma globulinemia. So there is no gamma globulin in the blood. So Bruton's X-linked gamma globulin is actually a rare genetic disorder where body cannot fight against infection, because there is all gamma globulinemia. So there is no globulin in the blood. So it is caused by a defect in B cell maturation. So B cell maturation leads to XLA. So Bruton's XLA, Bruton's or gamma globulinemia is called a defect in B cell maturation. So B cell does not mature, resulting in absent B cell functions. So mature B cells actually convert or differentiate to plasma cells, and thus producing antibodies. But there is severe deficiency of all immunoglobulin types, because B cell does not mature, B cell does not differentiate to plasma cell, hence not producing enough immunoglobulins, or let's say not at all, no any immunoglobulins at all. So T cells function remains intact. So due to the absence of B cells, primary lymphoid follicles and germinal centers weren't formed within lymph nodes. So there is absence of B cells, and hence primary lymphoid follicles and germinal centers so do not form. So germinal centers are where B cells actually mature. So there is no B cell maturation, therefore no primary lymphoid follicles and germinal centers are formed. So within the lymph nodes, there are no germinal centers, germinal center, as well as no primary lymphoid follicles. There is no any follicles. So follicles and germinal centers are one of the two of the most crucial segments of lymph nodes, or sections of lymph nodes, but they're not formed in Bruton's or gamma globulinemia, X-linked or gamma globulinemia. Okay, so lead poisoning occurs through occupational exposure. Symptoms include colic, abdominal pain, constipation. Also, there is something called basophilic stippling. Yeah, it's written here. So abdominal pain, constipation. Lead lines on the gum, peripheral neuropathy. So lead poisoning is one of the complex symptomatic disease, syndromic disease, which leads to colic, abdominal pain, constipation, lead lines in the gum. So there are some blue lines present in the gum. There is peripheral neuropathy suggested by tingling sensations, numb sensation, and And yeah, in the blood there is microcytic anemia, so anemic with normal iron studies. So there is no, it does not interfere with directly to iron metabolism, but actually yeah, there is it inhibits ferrochelatase, I guess. Yeah, ferrochelatase, and however the iron studies are normal, and in the peripheral blood smear there is basophil stippling. Okay, so keratin. Keratin is a marker of epithelial cell origin. So if there is any cell, for example, squamous cell carcinoma, then keratin is one of the, let's say, an important marker. Prospective cohort studies are organized by selecting a group of individuals, that is cohort. So cohort, a particular group of individuals are selected, that is a cohort is selected, determine the exposure status, and then following them over time for development of the disease of interest. Yeah, and they are exposed or not exposed based on their daily lives, and the outcome is and it is followed, the disease course is followed over the period of time and studied. Yeah, and according to 2019 estimates, the most common cancer, including basal and squamous cell cancer in women, by incidence of so the most common cancer in women are breast cancer. So breast cancer is the most common, including in lower income countries as well. Breast cancer is increasingly high, and then lung and colorectal cancer are also equally common. In terms of mortality, lung cancer claims the most lives, including COPD, which is one of the primary cause of mortality all over the world. And lung cancer also among the cancers. Lung cancer claims the most lives, followed by breast and colorectal cancer. So lung cancer followed by something that's outside it, that it's breast cancer, and then colorectal cancer. So yeah, carbon monoxide binds to iron in the blood. So there is high increased affinity of hemoglobin to carbon monoxide, possibly 220 times more affinity to hemoglobin, and therefore, you know, hemoglobin, carboxyhemoglobin is formed, and it has increased affinity of oxygen. Therefore, it causes a left shift in the curve and does not allow oxygen to be released in the peripheral tissues. Okay, SBS. So SBS, sickle cell hemoglobin aggregates in the lack of oxygenated state. So yeah, in a deoxygenated state, or let's say an hypoxic state, SBS aggregates and forms a fibrous stance that decrease IVC membrane flexibility and promotes sickling. Yeah, sickling occurs because of anoxia, and yeah, and anoxia means low levels of pH in the blood, so low pH and high levels of 2,3-BPZ. 2,3-BPZ and decreased acidity and 2,3-BPZ are almost concurrent. So 2,3-BPZ increases when there is an acidic condition, acidotic condition, and acidotic condition. And low pH include, let's say, high amount of 2,3-BPZ shifts the hemoglobin, oxygen hemoglobin curve to the right, and yeah, it releases much of oxygen but cannot withhold much of oxygen in the blood, and hence promotes sickling. Because of absent membrane flexibility, this inflex RBC is predisposed to microvascular occlusion and microinfarcts. And yeah, splenomegaly is one of the late complications of sickle cell disease, which occurs because of repetitive infarcts to the spleen, causing its atrophy and fibrosis later on. SBS contain valine in place of SBS. So sickle cell is formed because in place of glutamic acid at the sixth amino acid position of the beta globin chain. So in the beta globin chains, alpha and beta globin chain. So in the beta globin chains, at the sixth position of the amino acid, this should have been glutamic acid. However, it has been replaced by valine, and this promotes hydrophobic interaction among hemoglobin molecules and resulting. So there is some interaction between hemoglobin molecules and thus increased polymerization of HbS, thus resulting in sickling. SVF is fetal hemoglobin contains gamma globin instead of beta globin. So beta globin instead of beta globin, gamma globin is present in SVF. So patients with homozygotic beta thalassemia major. So beta thalassemia occurs because of, yeah, as discussed before, beta thalassemia occurs because of altered splicing or mRNA translational activities inside the cell, and in beta thalassemia, so beta globin, so beta globin proteins are deformed, or let's say not formed. They are beta thalassemia major. Homozygotic means both the beta cell genes are are mutated, and hence they present early at birth due to presence of gamma globins and SBF. So sorry, they present early, but SBF is something that is present in the baby even at birth. So, due to the presence of gamma globulins SBF, switching to SB production and cessation of gamma globulins synthesis precipitates the symptoms of beta thalassemia. So, beta thalassemia occurs because in the beta, in the beta globin production is impaired. So, yeah, the affinity of the mutated beta globulin in beta thalassemia does not allow the full functioning of the hemoglobin. So hemo and globin. So globin part is not properly functional. Therefore, you know there has to be a mechanism where the lack of beta chains is compensated by alpha alpha chains, and thus more alpha thalassemia alpha 4 traits can be seen. So beta thalassemia is manifest as an iron deficiency. So one of the causes of iron deficiency. Anyway, I could not describe it properly. Sorry for that. Yeah, I'll try to describe it later if you want the explanation more. Okay, chronic opiate use leads to the development of tolerance. So the more we use opioids, the more tolerance develops in the blood. Tolerance develops to the analgesic effects and most adverse effects, without the exception of constipation and meiosis. So constipation and meiosis are almost mandatory features of opiate, uh, with the exception of constipation and meiosis. Okay, constipation and meiosis are something that are not tolerant to chronic opiate use. They occur despite the opiates being used continuously, chronically. And to prevent bowel complications, it is recommended that patients be treated prophylactically with adequate fluid intake and daily laxatives. So, daily laxatives such as lactulose and adequate fluid hydration. Adequate hydration is very important to prevent bowel complications during chronic opiate use. So between 1950 and 2000, rising rates of tobacco use resulted in an increase in female lung cancer incidence. So between 1950 and 2000, so 1950 and 2000 and Indomini, rising rates of tobacco use resulted in increase in female lung cancer incidence and mortality. Lung cancer is commonly the most common cause of cancer death in both men and women in the US. So in the US, lung cancer is actually one of the most common, the commonest cancers there is in the world. So yeah, the rising use of tobacco by the females as well increased the incidence in the females, and is one of the rising cause of mortality worldwide. Vitamin K dependent clotting factors 2019 synthesis of the liver. So there's the liver. Factor 7 has the shortest half-life of the clotting factor. So plus factor 7, which is mostly involved in extrinsic pathways. So extrinsic pathway is has factor 7 in it. So failure of prothrombin time to correct with vitamin K supplementation indicates factor 7 deficiency, which is often due to underlying liver disease. So if there is a liver disease, then if there is a liver disease, if there is liver disease, then vitamin K synthesis is impaired. So vitamin K helps us in the sub 219 factors, chronic factors. So most, the factor with the shortest half-life is factor 7. So vitamin K supplementations must be given to prevent, the deficiency of factor 7 first. So because bleeding tendency can occur because of factor 7 deficiency in the very beginning of vitamin K deficiency, or in the case of liver disease that results in acute infective hepatitis or any sorts of liver disease. So failure of prothrombin time to correct with vitamin K supplementation. So PT is one of the important markers of extrinsic pathways. So vitamin supplementation is very important in liver disease. Patients started on warfarin developed transient hypercoagulable state to short half-life of protein C. Okay, so it's the same question on warfarin. So warfarin produces an anticoagulant effect. So actually it is a blood thinning medication, but it paradoxically increases the coagulative property of the blood, because initially in the very beginning protein C and S, which are actually the natural anticoagulating agents in blood, are inhibited, and thus it causes increased thrombotic features, and this hypercoagulation is further by pre-existing protein C deficiency. And if there is pre-existing protein C or protein S deficiency, then this hypercoagulation is exaggerated and can result in thrombotic occlusion of the microvessels, microvasculatures, with leading to skin necrosis. So it is the same answers of the previous question. So yeah, it is what it is. Abnormal bleeding in patients with uremia is due to qualitative platelet disorder. So qualitative platelet disorder means there is some defect not in the number but in the receptors of the platelets. So qualitative platelet disorder can be Werner-Solier syndrome and Glanzmann's thrombasthenia. Okay, so abnormal platelet bleeding. Abnormal bleeding means there is some defect in bleeding time. So uremia is one of the very important causes of dysfunction in the platelets qualitatively, and uremia is one of the causes of qualitative platelet disorder as well. And this causes prolonged BT, bleeding time, with normal platelet count, PTR, and APTT. So platelet count, there is bleeding tendency and prolonged bleeding time because platelets are disturbed, and however platelets count is normal. There is not any numerical defect of platelets. However, just the qualitative features of platelets, perhaps let's say the receptors, or let's say any significant features inside the cells, platelets are disturbed because of uremia. Thus other features are normal. Okay, cystocytes, or let's say helmet cells, are the broken segments of RBCs. They suggest MAHA, or microangiopathic hemolytic anemia. MAHA is also a feature of HUS, hemolytic uremic syndrome. There is hemolysis, therefore MAHA can occur. There is microvascular angiopathy occurs in HUS, as well as TTP, thrombotic thrombocytopenic purpura, thrombotic thrombocytopenic. So there's decreased platelet, however there is increased thrombotic tendency. Okay, DIC, cystocytes. So cystocyte, if there are cystocytes in blood peripheral smear, then we must always think of MAHA, microangiopathic hemolytic anemia, which is caused by HUS or TTP. Then DIC, or mechanical damage. Mechanical damage, or DIC. DIC is a paradoxical state of conjunctive coagulopathy. Alright, there's paradoxical thrombus formation in DIC as well, and mechanical damage is which is strike against the prosthetic valve, and the membranes are damaged, thus causing resulting in the formation of helmet cells, cystocytes, inside it. HUS is preceded by the bloody diarrhea. So inside it, to suspect HUS hemolytic uremic syndrome, there must be bloody diarrhea first. Bloody diarrhea precedes HUS. So before HUS, there is bloody diarrhea, means EHEC. So EHEC, or C-galactoxin, is let's say type 2 HUS. So type 2 HUS, it indicates type 2 HUS. Coagulation studies PT and APT are normal in HUS TTP, but I'm not DIC. So PT and APT are usually normal in HUS TTP, HUS and TTP. So hemolytic uremic syndrome and thrombotic thrombocytopenic purpura, but PT APT are disturbed in DIC. So PT APT, if abnormal, also are suggestive of disseminated intravascular coagulation or any septic state. DIC is a common condition of gram-negative bacterial sepsis due to activation of the coagulation cascade by bacterial endotoxins. So coagulation cascade is activated by bacterial endotoxins, which leads to the formation of microthrombi. Okay, platelet smear show fragment, there is helmet cells and thrombocytopenia, and lab shows decreased fibrils and levels because they are used up in forming fibrins throughout the body and prolonged PT and APT. So PT and APT are abnormal in DIC, as said earlier. Okay, the most common trigger for DIC in pregnancy is release of tissue factor, thromboplastin, from an injured placenta. So when there is placental abruption by, let's say, a car accident, then it releases tissue factor, thromboplastin, from the hidden endothelium of the cells into the maternal circulation. DIC presents with bleeding from incision sites, so oozing out of blood from the venopuncture site, IVDN sites, and mucosal surface due to rapid consumption of coagulative clotting factors and platelets. So okay, this makes sense. RBC fragments, Burr cells, and helmet cells are associated with either MAHA or mechanical vessel destruction. So RBC fragments, so which are cystocytes, Burr cells, and helmet cells. RBC fragments, helmet cells, Burr cells are almost a similar feature of hemolytic picture where RBC's membrane are disrupted, and in patients with prosthetic valve, RBCs with excessive shear and turbulence in the circulation, causing damage from mechanical trauma.